So my number one concern when I do rhinoplasty is that the result look natural. There are some cases where that's pretty easy. It's a small bump. It's not very dramatic. The change can be sharpening a tip or getting rid of a small bump. But there's certainly some cases where we start with a very big nose or a very crooked nose or a very wide nose or a nose with a very flat tip. Those results are going to come under the dramatic category. Those patients usually can go back to work still within 7 days. They have some bruising, maybe at 7 days. It's usually gone by 7 days. But their results are really fantastic and exciting. So in this case, this was a young lady who had been in the press quite a bit and made fun of for her nose. And she came to us and we had the idea of lowering the bump, sharpening the tip, raising the tip some. So I did the surgery, and this is her really probably 4 or 5 months later. These pictures are identified with her permission. The result looks extremely natural and looks like it balances her face really nicely. So this is a young lady in her mid-20s who came in to have her nose refined, made smaller, and her nostrils improved. And on this side view, you can see where the bump was removed, the tip was refined and raised, and the nostrils were narrowed some. There's a second view where really the subtlety of the surgery shows through better, and you can just see how much prettier this young lady is after having the surgery done. The nose just fits her face. It makes her eyes brighten, her forehead and cheeks stand out, as well as her chin, her nice long neck. So in this case, she's even got her ear exposed. It's just her anatomy and her facial features can shine now because she doesn't have this unusually large nose right in the center of everything. In this case, this is some dramatic bump. The tip is also a little bit big. You probably can't even make that out because the bump is so large. So in one surgery, I got rid of that giant bump and recontoured that portion of his face. So it now matches the rest of his face. So this is a good example of how when you change one thing that's so out of whack, the whole appearance can change. The whole face now looks much more balanced, even though the only thing that was done really was getting rid of the big bump on his nose. So surgery on these type of cases, what I call the dramatic rhinoplasty, is really rewarding for me. It's really something to see patients come in, do computer imaging, get a good idea, and then when you actually deliver it, they're so excited.